All right, thank you all so much for being here tonight. I'm so excited that we get to talk about this incredibly important topic, and it's not always easy to talk about either, so I'm glad that we're all here. I am Megan, like Ryan said, and I'm a board member at MPS. I am a registered nurse, and I'm a PhD candidate at Michigan State. And I've been interested in death and dying for as long as I can remember, so it is truly an honor to be here talking about this. The presentation is titled Transcending the Fear of Non-Being, Psychedelics, and End of Life. And this topic, the title was actually derived from a Thich Nhat Hanh quote, who said, "Our true nature is the nature of no birth and no death. Only when we touch our true nature can we transcend the fear of non-being." So I believe that is the essence of what psychedelics can help us with. And so today I will be talking about some psychedelic perspectives on death, also going through some research in this area. And then we'll have some time for questions. And then I will be sure to reserve some time at the end so that we can just have open discussion together. So Maddie is graciously helping us record this presentation so we can share it. But once it gets to the open discussion part, we will shut down the recording equipment. So it's just all of us hanging out, just so you know. I do want to also mention that although the presentation is titled Psychedelics for End of Life, some of my experiences have helped me understand that, to me, it's more of a transformation of life. And we do need concepts, and we do need to know what we're talking about. So I'll be using the words death or end of life throughout the presentation, but I also wanted to mention that. So first, thank you again for everyone who has been doing the work, stewarding these medicines, and doing research, and showing up to live and die in the best ways that we know how. So thank you all so much for being here too. So this is what we're going to start with, how we currently die. And I'll be talking about our culture here in the US primarily, but these ideas about death are different throughout different cultures. So I'll focus on how we die here in America. And then I'll provide some psychedelic perspectives on death. So that'll be from some folks who have done work in this area, either research or personal experimentation. And then we'll talk specifically about the studies that are going on or have been done. We'll talk about some implications for death and dying from the psychedelic research. And then finally, like I said, open discussion. And it's weird to be here talking about death. First, because I don't think that anyone can really speak with authority on this topic because it is partially such an individual experience, and also I don't really know anyone who has come back to tell the tale. So I'm also a humble steward of this work, and I'm excited to learn from everyone here as well. I'll start with a quote from Elizabeth Kubler-Ross, and she is a psychiatrist and an expert explorer on death. She says, "Dying is an integral part of life, as natural and predictable as being born. But birth is a cause for celebration, and death has become a dreaded and unspeakable issue to be avoided by every means possible in our modern society. It is perhaps this inevitable and unpredictable quality that makes death so frightening to many people, especially those who put a high value on being in control of their own existence, are offended by the thought that they too are subject to the forces of death." And I like this quote because it's about having control over your own existence. And I think that is something psychedelics can help us with, letting go of the need to control all of our experiences and being open to whatever life has to share with us. I also love this cartoon because I think it illustrates in a really light way how our avoidance of death in our culture doesn't really do much to ward it off. It really only harms us because it gets in the way of planning and having meaningful discussions like we are tonight. So even if we try to evade it, it can still be right there. So a bit about how we are dying now in America. Most experiences with death are marked with avoidance, usually up until the last moment, until we can't avoid it anymore. And this has big implications for us. By avoiding and denying death, we potentially miss out on important opportunities to learn about ourselves and to connect with other people. This can also potentiate suffering because if we avoid death, we don't have the opportunity to plan and prepare in ways that we might be able to if we looked it in the face and talked about it. Through these conversations, we can begin doing something revolutionary, which is recognizing that death is part of life. And it's never too soon to start practicing or preparing for death, which I think psychedelics can help us with in a lot of ways. By the time we reach the end of our lives, a lot of times we're not able to advocate for ourselves. And so it's important that we take our autonomy now and start talking about it and planning. Research has found that most people don't want to die in the hospital, only about 6% of people, but almost a third of us do die in the hospital. And a lot of times it looks like this up at the top. And this is usually because we don't talk about it before it's too late. So I love that we're here, and I love that psychedelics can help us start understanding our death in new ways. Most people have not talked about the end of their life to anyone before they've actually reached death. And quality of death is a weird term that has been used in research to assess the comfort of someone's end-of-life period. So this is a tricky concept because we can't necessarily reach out to someone and ask them how their death went. But we can look at how they were feeling and functioning up until the point of death. And we can also talk to family and friends and ask about their perceptions of the experience. What we found in research on quality of death is that a large proportion of people suffer from things like pain, depression, anxiety, demoralization, and hopelessness. Up to 50% of people with advanced illness report unmet spiritual or existential issues, and up to 50% of people who are nearing the end of life experience anxiety or depression. And we don't have many great tools to help address these issues near the end of life, especially tools that are able to work quickly and are able to help care for the entire person. Most deaths in America look more like the top photo than the bottom, although with growths in hospice and palliative care, and also with this psychedelic research, I feel hopeful that we're moving in the right direction and we're able to have more comfortable experiences. Holistic care means understanding that the mind, body, and spirit are all interconnected, and these work together to create our experience. Psychedelics can be helpful because they help us see the interconnection between all of these parts of ourselves. And they can also help address the areas where medicine can't reach right now, like spiritual care and psychological care. We do a pretty good job of helping care for symptoms, care for the physical aspects of folks, but things like our spirits aren't being cared for in the ways that they could. So I think psychedelics could be a great tool for this. Death transcendence is a term that points to the experience of overcoming death psychologically through identification with a phenomenon more enduring than oneself. And I like this term because it's not necessarily about running away from death or of not having to look at it or experience it, but actually through looking at it, the experience can be improved. So psychedelics with intention and with a safe container can reliably produce experiences of death transcendence. And these are both in folks who are really close to the end of their lives, if they have a terminal cancer or another terminal disease, or even folks like us who might not have a disease that makes death imminent, but we're just constantly thinking about it, or it's always kind of in the back of our minds. So we don't have to wait until we have 6 months or less to experience death transcendence. I think it's something that we can start practicing now. And I also think it's a practice that you don't necessarily get done, and you're always comfortable with it. So now we'll go through a couple of psychedelic perspectives on death. And again, these are from some pioneers who've done research in this area, and also some people who just use psychedelics themselves. So first, from our beloved Ram Dass, who recently passed, he says, "A human birth is a bit like enrolling in the 4th grade. We stay as long as necessary to achieve what we need from that specific grade or form. Then we're naturally ready to go on for further evolution by leaving this plane." And I like this idea because psychedelics can show us a broader sense of our life situation. It's almost like zooming out and seeing things on a larger scale. I also like this idea because leaving the 4th grade can still include some grief and some sadness. It's not necessarily like, I don't care about death anymore, or I'm just ready to go. But it's about honoring an ending, feeling whatever feelings are associated with it, and not running away from it. Roshi Joan Halifax has said, "We normally make a false dichotomy between living and dying, when in reality there is no separation. We can live and practice in such a way that dying is a natural rite of passage, a completion of life, and even the ultimate liberation." Psychedelics can show us that there isn't a separation between life and death, that they're actually one and the same. So it's a false dichotomy, like Joan says. And our friend Timothy Leary, he says, "I'm looking forward to the most fascinating experience of my life, dying. You've got to approach dying in the way that you live your life, with curiosity, with hope, fascination, and courage, and with the help of your friends. I'm determined to give death a better name or die trying. You've got to take charge of it, plan it, talk with your friends about it." So I love that that's what we're doing here today. And then Aldous Huxley, he wrote and spoke about psychedelics through his life, and specifically about using them for helping people with end-of-life care. And so Huxley was a writer, but he was also instrumental in designing and carrying out some of the first research with psychedelics in folks at the end of life. He wrote yet another project, the administration of LSD to terminal cancer cases, or people, in the hope that it would make dying a more spiritual, less strictly physiological process, which I believe is happening now. And then famously, he also requested 100 micrograms of LSD intramuscular on the last day of his life, which his wife Laura was able to administer to him. And after that experience, Laura wrote, "The 5 people that were in the room all said it was the most serene, most beautiful death. Both the doctors and nurses said they had never seen a person in a similar physical condition going off so completely without pain and without struggle." So he was actually in the LSD experience toward the end of his life, like in the last moments. And so that's not necessarily how psychedelics are being used right now, but it is another option, another perspective. So now we'll be going through some of the research studies that have been done in this area. And I do want to say that this isn't a comprehensive review of all of the research that has been done or that is ongoing, but these are some of the highlights that I think are most important. Most of this work has been done with psilocybin and is being done with psilocybin. And this is mostly because it is shorter acting. It's really physiologically safe. And there's less cultural baggage. So there isn't, like with LSD, as much stigma around it. And also shorter acting is important because it's being done in research settings. So we don't necessarily want to have people in the experience for so many hours. But it actually started with LSD. So Spring Grove was the first place that, that I know about that the research was outwardly being done. And so they used LSD. But now there are 3 main places doing psilocybin research with folks who are at the end of life. And that includes Johns Hopkins, UCLA, and NYU. And then I'll just touch on briefly a little bit of research about DMT and death. And then I also found one study with MDMA for people who were near the end of their life. And that one actually had to end early. It was through Harvard because they didn't have enough funds and they weren't able to recruit enough participants, which I thought was really strange and surprising. So most of the work is now focused on psilocybin. So as I mentioned, Spring Grove was the first place that this was happening, and this was in the late 60s. Researchers at Spring Grove were giving people LSD near the end of their life, and they had cancer that was considered terminal, which meant that it had a really low probability of being cured. So these folks could be varying lengths from their actual death, but they all had cancer that was considered incurable. So there were 17 brave people who signed up for the study, and it included preparation sessions, an LSD session with 250 to 800 micrograms, and I wasn't able to find any info on the dose determination, like who got 250 and who got 800. So my guess is weight-based, but I'm not sure about that. And it was provided intramuscularly in a safe therapeutic context. It included the usual stuff that we see today, like eye shades, a really comfortable place to sit or lay, headphones, and then standardized music that was played throughout each of the therapy sessions. And this Spring Grove study really set the context for the rest of the research that's happening now. So it actually still looks really similar with eye shades, headphones, standard music, and all of that. The Spring Grove study found that administration of LSD was safe and it was feasible for people who were near the end of their life, that there weren't any adverse events. And there were profound changes in these folks in terms of their anxiety, depression, and pain, and also decrease in their fear of death. A third of the people in the study improved dramatically on these measures, a third improved moderately, and a third were not seen to be improved, but that was based on the psychological instruments that we were using. So we may or may not have been able to capture all the changes in all the people. So this happened before the research was stopped, and then there was obviously quite a gap between this research was in the mid-60s to what's happening now. This is from a recent New York Times article, and it says, "I have no desire to take a trip right now, but if I were diagnosed with terminal illness, I would definitely consider the use of psilocybin." So this dude's flying through the air with his third eye open and his IV pole. So it's exciting to see how this is proliferating through the New York Times, all different places. So Johns Hopkins did multiple studies with psilocybin. So the first one I'll talk about is with healthy volunteers. And although these people didn't have a terminal illness, I don't think that we need to create such a stark line between living and dying. And these folks talked a lot about death, even though they weren't necessarily like right near the end of their life. So I included this one as well. And this study was with 36 healthy volunteers. They were all different age ranges, and they were primarily females. It also included the preparation sessions, the intentional controlled environment, and then some integration sessions afterward. And this study included 2 to 3 medicine sessions, so people could elect to keep going. And not surprisingly, people wanted more sessions after the first. Psilocybin was 30 milligrams per 70 kilograms of weight versus a just control placebo condition. And most of the time during the sessions, people were encouraged to lay down, put on their eye shades and their headphones, and go inward into their experience, like we see with most of the other research. So they weren't actively guided to talk about death, think about anything in particular. They were just encouraged to experience whatever was happening. If they reported significant fear or anxiety, there were 2 guides there to help them. I'm not sure if guides is the right word. We talk about that a lot, but there were 2 people there to help support them. So again, these were with healthy people who were in this study, and we found that psilocybin was safe and feasible to be administered. Of course, we knew that, but we have to do lots of research to find it out. And psilocybin was able to occasion mystical experiences that had really similar characteristics to classic mystical experiences, which are provided through all different routes. And participants said that they had substantial personal meaning and spiritual significance. One of the study participants wrote in their post-session journal, "To cease to be, as I understand it, was not frightening. It was safe and much greater than I have words for understanding or understanding of. whatever is larger than the state of being was holding me. So again, these people weren't actively dying, they weren't really close to the end of their lives, but there were still a lot of themes that they were experiencing this death transcendence. So I think it's exciting that we can gain perspectives like this now before we are right near the end of our lives. And so this was kind of the precursor to the Johns Hopkins study that was focused on people with terminal cancer. So the second study included 51 people with a life-threatening cancer diagnosis, and they all had to have symptoms of either anxiety and or depression. So they had to have some type of existential suffering to be eligible for the study. Again, it included preparation and then follow-up integration sessions, and the dose here was either high or low psilocybin. So they didn't use another medicine as a control, they just used a really small amount of psilocybin. So it was either 1 or 3 milligrams per 70 kilograms as the low dose, or 22 or 30 milligrams per 70 kilograms as the high dose. And the Johns Hopkins folks actually applied to have hiatus of approved for this lower dose. So you'll see that each of the studies had a bit different dosage.
What's the rough translation between that and dry grams?
I don't know. Does anyone else have info on that? Psilocybin, straight versus dry.
I think it's difficult to say because different strains of mushrooms can have different concentrations of medicine when you harvest them, X concentration, and it varies really wildly among, even like if you grow a batch of mushrooms, 2 mushrooms in the same batch can have wildly different concentrations of psilocybin. The stuff that I've read has said that if you're like 3.5 grams of dried mushrooms would be roughly equivalent to like the dosages that were delivered on the high end in many of these studies. But that's just a rough estimate.
Oh, you're perfect. Thank you for crowdsourcing that. Also, it's important to note that we don't know like what the right dosage is here either. So this is what the FDA would allow, but it's different for every different situation. And so this second study, this was with folks who were near the end of their life, and we found that high-dose psilocybin produced large decreases in self-rated and clinician-rated measures of depressed mood, anxiety, generalized anxiety, and then death-specific anxiety as well. And that participants had increases in their quality of life, sense of meaning in life, and sense of optimism. So these were all people with a terminal, quote-unquote, cancer diagnosis. And psilocybin was able to help instill a sense of optimism about life, which I think is incredible. And then at 6-month follow-up after the session, the changes were sustained. And the second study was at UCLA, and this was a smaller one with just 12 people who had advanced metastatic cancer, and they all had some degree of anxiety. People were 18 to 70 years old, and again, primarily females, which is interesting. I wonder why the studies keep shaking out this way. It also included prep sessions, the actual medicine session, and integration. And here the psilocybin dose was a little bit different, and then they also used niacin as the control here. And these ones were conducted in a hospital room, and I had some photos, but they were too grainy, so I didn't include them. But they kind of just put tapestries over all of the hospital equipment, so it wasn't the optimal environment, but it was better than a straight hospital room. So that's something to consider moving forward, is having really safe, comfortable spaces to have these sessions. So the UCLA study found that, again, psilocybin was safe and was feasible. We didn't have any adverse events, and even like heart rate and blood pressure for people were just very, very slightly increased. So physiologically, they were incredibly safe, these sessions. And participants reported decrease in their anxiety, which continued for 6 months, decrease in depression, which was modest over 2 weeks, and then continued to improve over the next 6 months. And people reported a sense of insight and resolution of issues after their sessions. One of the main investigators, Dr. Charles Grobe, said critically ill patients were able to undergo psychospiritual epiphanies, often with powerful and sustained improvement in mood and diminished need for narcotic pain medications. So one of my personal interests in my dissertation research is about pain and how it's not just a physical experience, and that it actually includes our thoughts and emotions and our spiritual aspects as well. So I'm excited about the idea that through psilocybin, over time, pain can continuously be decreased, which I think is a really big testament that it's not just a physical experience. Yes?
Did this study also have preparatory sessions?
Oh, it did. I appreciate that. So they're all the same setup. It's always the prep, the session, and then integration as well. Yeah.
So all of these were double-blind studies that had placebos. You didn't mention anything about what the people that took placebos, what they experienced.
Yes, so we don't necessarily have that information, but what these studies looked at is which group changed more. So we would track the placebo group and we would track the intervention group and then see if they were significantly different on these measures. So the placebo groups did not significantly change on their anxiety, depression, anything else, but the psilocybin groups did.
How many of the psilocybin group did?
That's an interesting question. I don't know. We looked at, well, these research studies that I read looked at everyone kind of grouped together. So we do know that in the Spring Grove, the first study that we talked about, which was like mid-60s, a third improved, a third stayed the same, and a third improved like a little bit. So we had levels of improvement, but that's not something that I've seen published recently.
Were the UCLA and the Hopkins study done about the same time within the same frame?
Yes, they were. Mm-hmm. Yes.
In your research, did you come across any, studies or whether they were double-blind or not, in terms of comparison of people that took LSD, psilocybin, DMT, or ayahuasca? And I think that would be important as part of the discussion.
Yes, that is very interesting. I didn't see any work with ayahuasca for people actually near the end of life, but I also suspect that if folks who were kind of not near the end of life, it's a weird distinction to make because who knows, but that there are constantly themes of death in our experiences anyways, so I get the sense that that might be helpful. My first instinct is that I wouldn't necessarily recommend ayahuasca for someone who is near the end of their life because of the physiological effects, that it might not be as safe as something like mushrooms. So that's something to consider. I appreciate this discussion and your questions. So for the NYU study, it included 29 participants with anxiety related to their cancer diagnosis, and about 62% of these folks had advanced cancer. So that means that it had metastasized somewhere else in their body, and generally at this point we have a pretty low probability of being able to cure them. So again, this included the prep session, the medicine session, and the integration. We're never just sending mushrooms home with people. And this one was a little bit higher than the last dose. So this was 0.3 milligrams per kilogram. And then it also included niacin as the control. It was a little bit unique in that it included both quantitative and qualitative follow-up. So it was not only the quantitative instruments to see how specific variables changed, but it also included some interviews and then actually analysis of the themes that way. And then it also included long-term follow-up, which is the only study that I've seen of this kind. So we checked in with folks in the NYU trial at 3.2 and 4.5 years after their session. So for the quantitative results, we found that people who received the psilocybin-assisted therapy had, again, improvements in their anxiety and depression. So this is consistent through all the studies, and they've been pretty large improvements. Also, demoralization and hopelessness were improved, which is something that, of course, a lot of people face near the end of their lives. About 80% of people showed sustained benefits 7 months after their session. And those who reported having a mystical experience had even better improvements in symptoms and in their mental health. And about 90% of the people reported improved life satisfaction, which they attributed to their psilocybin sessions. And these are some of the qualitative results. So this is what participants both wrote in their post-session journal and then also spoke out loud in their interviews. So one person said there was a reckoning which came with cancer, and this reckoning was enhanced by the psilocybin experience. I have a greater appreciation and a sense of gratitude for being alive. I like this one because it was described as a reckoning. You might know that psilocybin sessions are not always easy and they're not always comfortable. So this is something that might be difficult, but also includes all of these incredible benefits. And so this person, despite having advanced cancer, was able to find a sense of gratitude for being alive. And I think this also speaks to the importance of talking about death and addressing death, and that it actually makes our lives a lot better. So that's why we're doing it. Someone else said, I've always been afraid of rejection. I experienced such overwhelming love in my psilocybin experience, and it gave me a new confidence. I threw myself a birthday party and invited more people than I thought I ever could, and they came. The extreme depth of love I felt changed the way I relate to others. It gave me a feeling that I have a right to be here and to enjoy life. So I think it's literally never too late to experience feeling like you have a right to be alive. And then finally, the experience reinforced the understanding that we are all very much together, and that the prevailing feeling in the end is love. And at the long-term follow-up in the NYU study, this was, again, 3.2 and 4.5 years post-intervention. So these were for the folks who were able to survive that long, so 4.5 years after the session. People still experience reduction in anxiety, depression, hopelessness, demoralization, and death anxiety at both of these follow-up points. At 4.5 years out from the experience, 60 to 80% of people met criteria for clinically significant decreases in their depression and their anxiety, 4.5 years after. And 71 to 100% of people attributed positive changes in their life directly to their psilocybin experience and rated it among the most personally meaningful and spiritually significant experiences of their lives. People were comparing their psilocybin experience to things like giving birth or to witnessing death of their loved ones. So this was one of the most significant experiences. And then I also want to touch just briefly on death and DMT. We have had this discussion a number of times here, people talking about DMT in our brains and bodies. So there isn't a ton of research in this area, although it is expanding. So you all might have some things to add here as well. Some research found that the phenomenology, so how people describe the experience of of DMT sessions and near-death experiences, which are occasioned by other things like advanced illness or actual threat to death, they were incredibly similar. So the way that people described them, and even using like near-death experience scales to see whether or not you've had one, DMT experiences and I guess real, I don't know if that's right, but other near-death experiences were incredibly similar. And both types of near-death experiences were associated with long-term positive impacts in psychological well-being, along with a greater sense of concern for other people, reductions in death anxiety, reduced interest in possessions and social status, increased appreciation for nature, and increased self-worth. So this research wasn't with folks who were near the end of life, but it has obvious implications for our relationship with death. And then I also have a question mark here next to DMT released at death. We have a lot of speculation and a lot of people talking about that is the mechanism for both near-death experiences and then kind of helping us get into death, if that's a thing. But there isn't research with humans that show that this is true. There are a few studies with rats who were induced to have heart attacks, and then we looked at what was happening in their brain, and there was a wash of DMT and then big connection through all of the different areas of the brain, and then the rat was dead. So we have a little bit of evidence that that might be similar to what happens in humans, but obviously we have a lot of different incredibly complex mechanisms. So this is something that we need more research on for sure.
Just quickly, what does BMT stand for?
Want to crowdsource that? Does anyone know? dimethyltryptamine, is that right? So, a couple conclusions and implications from this research. Both psilocybin and LSD can be safely administered to folks who are near the end of their life. And with the appropriate preparation, a safe container for the experience, and support for integration, psychedelic experiences can lead to reduced anxiety, depression, demoralization, and hopelessness, and can improve pain over time. More research is needed in this area, especially looking into how we can share these experiences on a broader scale and get them out to more people. So right now, most of the research has been done with folks who are white, who are pretty well educated, who are at a higher socioeconomic status. So we need some real help in getting this work out on a broader scale and having access to more people. Most of these research studies have found that psychedelic experiences can serve as practice for letting go. So psychedelic experiences can help us look at our habitual ways of knowing, our habitual ways of being and thinking about things, and then we can practice letting those go and seeing a different way. We can also practice letting go of our ideas of who we are, of who we believe other people to be, which I think can be really helpful. And we can also practice trusting in our own experience and in an open-hearted way without judgment, just experience what is happening, which I think is one of the most helpful things when facing death. And psychedelic experiences can also remind us that change is the natural way of things, so we can become more open to all types of changes, and then death is one of those changes. There are far-reaching implications for the research in terms of enhancing our quality of life and our quality of death, because I don't think that those are necessarily separate things. So of course, we can have profound spiritual experiences of transcendence with psychedelics. And I also want to be sure to talk about that psychedelics are not only about transcending death or necessarily feeling better about it, but being able to see that grief and sadness and sorrow can co-occur with happiness and excitement and a sense of transcendence. So I believe that psychedelics can also be helpful for getting us activated about planning for the end of our lives. So this is not something that has been in the literature or researched at all, but this is something that I've experienced, is that we can face death before we absolutely have to. We can come to grips with it before we are right there and needing to plan for it. So we can do things like letting people know how we want to die, if we want to be in the hospital or at home or somewhere else. We can select a healthcare proxy or someone who's going to make decisions for us if we're not able to anymore. We can have conversations about what kind of medications we might want or not want, and how much medication we might be willing to have if needed. We can also talk about how we want to be treated after our death, our bodies. So whether we want to be cremated, buried, or something else. And there are a lot of exciting, environmentally friendly ways that we can take care of our bodies now. So through psychedelic experiences, I think that we can, with more courage and more grace, have these conversations and make these important decisions. And importantly, we can take control of our own rituals about end of life. So psychedelics can help give us that inspiration and give us that time to really create our last time here in the juiciest, most exciting way possible. And then I also think that psychedelics could be helpful for grief support. So for the family and friends who are experiencing grief, it might be helpful to see a broader perspective on things. And again, not necessarily to say, oh, it's fine, they're just gone, and just let go of it, but to experience a sense of grief and something else, something greater.
Can I stay with that just a quick minute?
Yeah.
I have this nagging question.
What's that?
So the patient is going to deal with a session.
Mm-hmm.
Is it, I know you're doing research, the recommendation is how, you've got a family of people around you. Is it beneficial in any way for caregiver or someone in their circle of influence to also feel through a session empathetic and more supportive, and there's nothing out there on this, I know.
There's nothing out there,
Any
but I think
story.
that could be incredibly important and incredibly helpful. If we've got a group of people helping support us through the experience of death, I think that's one of the most important things. So to have a group of people who are on the same page, who are having the same experience, I think it could be really helpful. Yes, but to have it separate. And even to have a sense of like communication and connection about the experiences after could be helpful. Yeah.
Your question reminds me of the, in fact, not with psilocybin and end of life or LSD, but with MDMA to treat PTSD, especially in veterans. There are some studies where they did then offer the spouse a session, because especially for veterans coming back with PTSD, it's such a difficult dynamic at home, and they have many decades hopefully to go, so that has
Have they
been-
done this study? Is this a
They
map
have-
study related to the MDMA?
They've done this with MDMA and for PTSD.
Yeah, but MAPS is sort of at the funded.
I think it was MAPS.
Okay.
I'm almost positive.
And in some of this research, they identified a like primary support person, so a spouse or a good friend or whoever was actually caring for the person who was near the end of their life. And that person was invited to come to some of the prep sessions. So they had a sense of what was going to happen, what kind of changes they might see, and how they could best support their partner through the experience. But they didn't actually have any psychedelic experiences. Not yet, at least. Yeah. So how might this research inform the future of end-of-life care? So first, expansion into more diverse subpopulations of people. We need to have all types of people involved in this work, and not just people who are highly educated and have enough money to access the therapies. Again, I think that psychedelics can be incredible preparation for death, and that we can start practicing, we can start planning, we can start having important conversations about death like we are tonight. And I also envision psychedelic hospices as places where people can go to have this type of treatment, and also to have a more open, safe space to face death, and not necessarily create such a hard boundary between who's living and who's dying, because that's, again, just a false line that we draw. So I picture community-based care where we can have more folks involved in caring for people who are near the end of life, so that it isn't necessarily always outsourced to places like hospitals and nursing homes, that we can actually be involved in caring for the people who we love. I also think it's really powerful to be able to create our own rituals and our own meaning. So again, not outsourcing that to somebody else and buying a funeral in a box, but maybe creating like the rituals that we find meaningful. And so psychedelics can help inform those rituals and help activate us to actually put them into place. And then I also see the psychedelic hospices as offering psychedelic-assisted therapy for both people who are facing the end of life imminently and the grief of anyone who might be around them. I recently started a project called Creative Dying, and so our site is creativedying.org, and this is a slow but steady climb to creating these psychedelic hospice centers. So I invite anyone to be involved with me to do this. So to wrap up, a common theme that is throughout this research and also throughout other people's personal experiences with psychedelics are a realization that we are infinitely more than we previously thought we were. And this is kind of the central part of how our relationship with death might change, understanding that we are more than we previously thought. This realization changes how we think about our past experiences and everything that has led us up to where we are now. And then our future changes because we're able to see things differently, and we're able to live in a more authentic way and have less fear of death. Because ultimately, connecting with death isn't really about death at all. It's about connecting to life in a deeper way, because they're not so separate after all. This Buddhist writer says, by meditating on death, we paradoxically become conscious of life, how extraordinary it is to be here at all. Awareness of death can jolt us awake to the sensuality of existence. I have some references here of all of the studies that I talked about in the presentation, along with some interesting books, documentaries, and other resources. So either you can take a picture, or I'm happy to send this to anyone after if you'd like. And so now we have some time for questions and for open discussion. So I appreciate all of you coming here. Looks like you have a question already. Thank you.